Urinary incontinence is an involuntary contraction of the bladder or the detrusor muscle where there is loss of control of urine. You cannot talk about incontinence and don't talk about urge and overactive bladder, because those two are the main components of what we discuss when we talk about urinary incontinence. Now, urge incontinence is the inability to hold the urine, to postpone urination. And so you may have women who have urge incontinence or the overactive bladder type of incontinence, and they are not wet. If you're wet, it's one issue. If you're dry, it's another issue. So the patients that are wet are the ones who really want to be dry, because it's no fun being wet. So these patients may be tried empirically on medications. So there are pills, there are several pills that in a class of medications that we can use. These medications are tried in an effort to get the patient dry. They're also tried in an effort to get the patient who has an urgency to go to the bathroom, but who's dry, to postpone the urge or to give a longer lag time so that patient does not have to rush to get there. The medications are also used. Sometimes we find that these patients may have small bladders, or sometimes it's not a small bladder, it's just a bladder that contracts involuntarily at its own time. And so we like to buy the patient's time, and we find that medications sometimes will work. On the other hand, if you have stress urinary incontinence, this is not an issue that responds very well to medication. It responds extremely well to surgical procedures, and there are a number of surgical procedures that can be done to correct this issue. But we have to let patients know that it's nothing really to be embarrassed about. Why? Because there's help, and there's a lot of help, whether it's medication, whether it's a surgical procedure, but the help is available.